This is not good for the patient. It is good for the organs.
Look, these people are on their way to death.
Yes.
A lot of them.
So are you and I.
Well, I know. They're going to die.
Yes.
So
is this a philosopher splitting hairs? You bet. You bet I am. You bet I am. I'm splitting hairs. Because as good as dead is not dead. And it's not up to physicians. It's up to the legislature of the state of Ohio and the separate states to determine what our legal criteria are.
And if we make people wonder, well, they're just going to say dead enough or sort of dead or kind of dead, close enough, because they want organs. And that's what's driving the determination of death. That's not good public policy.
And it may be more than just bad policy.
I understand that you told the lawyers for one of the most renowned heart institutions in the world that you would indict them for murder.
It wasn't quite that explicit a threat. It was more like an assurance that this type of protocol results in a homicide.
What was their reaction?
Oh, they took it very seriously. They assured us that they had not used it.
Oh, they backed off?
Right, they're not going to use it.
The Cleveland Clinic declined to talk to us on camera, but the hospital said Regitine is not harmful to patients and that their protocol met the highest legal and ethical standards. The Cleveland Clinic isn't the only hospital to consider taking organs from brain-damaged patients. The University of Wisconsin Hospital has actually done exactly that in more than 100 operations. Dr. Hans Solinger chairs Wisconsin's transplant unit. He's also president of the American Society of Transplant Surgeons. Dr. Solinger insists the patients are brain dead by the time their organs are removed.
You can guarantee that the patient whose organs are being harvested feels no pain.
Yeah.
You're sure?
I would say the patient is brain dead. A patient has no sensation. That's the definition of brain death.
But the hospital's own protocol is not nearly so certain. It says, quote, if there is doubt about the patient's ability to experience pain, it is appropriate to prescribe analgesic or pain medication prior to transfer to the operating room. The Cleveland Clinic protocol had a similar provision.
The protocol that we looked at said a morphine drip may be maintained for comfort. And the two...
Whose comfort? The person's comfort?
Apparently, that's who's getting it.
I think in situations where pain-relieving medications are still being given, it's a clear sign that someone does not believe that death has come.
In addition, Wisconsin gives the same potentially harmful organ-preserving drugs that the doctors in Cleveland had planned to use. Dr. Solinger said these drugs have essentially no side effects.
How do these drugs benefit the patient, who is, of course, still living when you give them these drugs?
They benefit the patient.
So it's just to benefit the organs?
That's correct.
In addition to giving patients Regitine, Wisconsin's transplant team administers heparin, an anti-clotting drug that also keeps organs healthy. But under certain conditions, heparin can be harmful, specifically in the kind of head-injured patients being used as organ donors. Again, Dr. Liestma, the neuropathologist.
To give a head-injured person heparin just without qualification would be potentially a very, very dangerous thing, because the individual could continue to bleed inside the brain and could kill them.
And you're not only giving them heparin, you're giving them a massive dose of it, isn't that right?
It's a large dose, yes.
Standard dose is 5,000 units, yet in one of your own papers you say you give 30,000 units, 6 times the normal amount, to patients who may have serious brain bleeding or damage. Can you tell us the name of just one expert who would say that it is safe?
You know, I'm afraid we are turning things around here. It's impossible that this dose of heparin, even if it's a large dose, within the short time interval, will have a negative effect on the patient.
But brain-damaged patients don't always die right after life support is withdrawn.
If the person doesn't die on demand, if they continue to sustain a heartbeat, they are returned to the floor in the care of the attending physician. Now, is that patient better off or worse off with those medications on board? They're worse off.
The district attorney in Madison said the Wisconsin protocol did not violate any laws. Wisconsin is not alone in trying out this controversial form of organ procurement. A 1994 survey found that 1/3 of the organ procurement agencies in this country already have protocols that allow doctors to seek organs from patients who are not brain dead. And we found out that some, but not all of them, use Regitine or heparin. But the fact is that only a tiny fraction of all organs come from brain-damaged patients. And Dr. Kaplan worries that in trying to procure these comparatively few organs, hospitals may frighten away potential donors.
Organ donation saves lives. And anything that in the least bit compromises that requisite trust between families of dying people and doctors, even the hint of a suggestion that people have cut corners, fudged the line of where death is, done anything to bring death about, is going to damage tremendously organ donation in this country.
This obviously is a controversy that you do not find unexpected.
Of course not. The whole issue of organ donation has been a controversy. And whenever you individually or a group of individuals goes out on the frontiers of medicine, there will be some controversy. But I think what is important to say is that right now in the United States, 22,000 people's lives are being saved every year.
Please understand, doctors on both sides of this controversy see no reason for any of you to tear up your organ donor's card. The chances of this happening to you or some member of your family are already minuscule, and now that this controversy is finally out in the open, the chances are probably nil.